get started is our talk from February 2023 at the Gibson Center of Active Seniors and all adults in general. All right. Is there an age minimum here? Do you have to be old enough to be here or no?
No, I don't think so.
I want to make sure. They do take kids if you want to hang out.
Mm-hmm.
So we're here to talk about how do we stand, how do we sit, how do we check our posture when we sit and stand, and how do we do exercise and stretching to make our posture better if it's not. Okay, simple. When I say simple things, it's almost, I have one for you one too. I have one for you one also.
Do you have an extra or do you? No.
Let's see.
I do not.
I have
I
one.
don't either.
I
I changed purses and I don't have an extra.
I brought one in my purse today. Here you go.
Okay.
Here you go. See if that works for you. All right. Yeah, we want to understand is where is our body now? Is our posture causing our pain sometimes versus something else may cause pain? And so the first topic to talk about is posture is your number one reason for non-traumatic neck or back pain. The last, 2.5 years now since COVID started, we've done what? We've stayed home. We've sat a lot. We haven't moved. We're supposed to. But with that happening, I've seen in my office as a chiropractor more neck pain, more back pain, more shoulder pain, more headaches, even numbness, tingling, burning, nerve pain from people sitting too much. And right now people are trying to transition, if they're working, into a stay-home type of a work where you work from home. So my thing is, how do we do those? Your stressors may be non-moving, sitting for example, or standing, and how do we do our day without causing pain and feeling strong and healthy? That's the plan, right? We have to, okay? So
How long is it okay to sit?
as long as you want to sit, if your back is strong. Do you have strong enough muscles to endure your day? That's the biggest thing. How do we, and this is not this talk today, but how do we build muscles over time in our back, neck, shoulders, upper back, everywhere, our legs too, to build those muscles, muscle mass to endure our day? We have to figure out for you what's going to help you get there slowly, a step process, right? So where are you now, today? How do we get to better state of health tomorrow and build on top of that every day? Everyone's out there at whatever level wherever state you are in, how do we get to better state?
But when you're sitting on, you don't think about strengthening your back, you know?
So how do we say?
Think about the arms, the legs, but I don't think about strengthening the back.
And what we're going to do is walk through how to know where your posture should be to get your body better and hold that position longer without effort. Efficiency. We make our posture a better position by being more efficient. So first of all, we talk about is, and for yourself, think about what percentage of our day do we sit and how much do we stand? Mine is probably, out of my day, probably 60%, probably 50% sitting, probably 60% sitting, 60%, and then 40% standing. So mine is about 60-40, sitting to standing. So whatever you do, okay, how do we make my muscles stronger to handle that ratio of sitting to standing? It's up to you, you know? But we have to do certain things to make our body handle that position. So number one is how do we check our posture? Where are you in space, in your environment? So for standing, let's do reverse. Let's do sitting first. I'm already sitting. If I sit, most people sit like this. Okay? Simple things. Standard sitting position. I'm using the back of the chair. My feet are in front of me. My knees are about the level of my hips. I'm leaning back. I feel relaxed this way. Right? Okay? Normal position. Our switch to help our posture, make our muscles feel like they're active, make our body work efficient so we're not wearing ourselves down, to make our muscles move more. For this position I'm going to do, I'm going to slide forward in my chair. Okay? I want to be on ideally the first third of my chair where I feel like I have to balance my body a little bit more. When I sit up from here, third of the chair, I want to make sure I bring my legs, my feet underneath me, either underneath my chair directly or outside of the legs, out here, to make my body now sit up.
That works.
Fantastic.
I just did it and it works.
Yeah.
Try it.
When we sit up this way, Now the center of gravity of our body, our gravity, center of gravity is here, not out here. We can naturally now hold our body up here because our body has to balance. We balance, our muscles will naturally, unconsciously activate to keep our body up. So the goal is, position-wise, we sit on the front of the chair, have our knees below our hips, have our feet underneath us, so if you want to be on your toes, perfectly on your toes, that gives you the best center of gravity, so your body can hold your body up instead of being slouched in position. We talked a second ago too about our body mechanically or structurally is not evenly balanced. Our facial bones and teeth our facial bones and teeth are more the way of the skull. So we're prone when we relax to lean forward. So we want to make sure we focus with that head not tilting up, but pushing straight back here over our shoulders. Does that make sense? If I'm here, now my body's more balanced.
Chin back.
Chin back. Not up, not tilted, but straight back. Okay?
You're in the right position.
At that point, if we're balanced, then our body can stay here and hold that better position. That's the plan. Any questions yet? How's that feel?
Do you sit always like that or for
No.
a short time?
Period of time, and then for that, it's good. Good. So if you're enduring this, it's your first time doing it for a while, you can do is I recommend bring 1 foot forward and rest a little bit on that leg. That point feels okay. Switch sides, rest your leg over here.
Because when you do that, you are going forward.
A little bit. You're using your elbow, your arm, to push yourself up a little bit.
Okay.
So as if you can't visualize it, as you want to do, if you want to take a switch from that ideal position, bring one leg out, bring your elbow or your forearm down on that leg to push yourself up a little bit, keep your body up. The goal is we want that lower back to feel arched going backwards is the key, to make your overall body feel like you're leaning back instead of leaning forward. That's the goal. By doing that, then your muscles activate naturally to hold you up. Again, my patients do this. You go, man, I'm sore the next day. I go, fantastic. If you're sore, now you're working the muscles to make them stronger to adapt to a better position. Adapting to a better position may take 2-3 weeks. Depends how much you sit, how much you stand, everything you do. By incorporating other exercises too, down the line, it'll help you stay here longer. Again, it's getting those endurance muscles over time stronger to endure sitting this way better. At that point, your shoulders are back more, your head's further back, you're in a better position like you would be standing. Okay? So now going to standing position here, standing position here, I want to make sure to check your standing position. I'm not going to know if I'm out here, right? I'm like, I feel fine, I'm good. All right, good. Let's go. The wall is usually, especially in Upland, they're pretty good with their circular inspections, is pretty much level and flat. Okay, Upland's pretty good about that. Hello. So for the second technique you want to do now, bring your heels against the wall, hips against the wall, and now shoulder against the wall, and head against the wall. That's ideal. Okay? May not feel good, but that's how you check your standing posture. Can I get my hips?
Walk out while you're in that position. Walk forward. Nice and tall. You did it.
Great.
You did it.
So I want to check again. Heels, hips, shoulder, and head against the wall, and hold that for about 10-15 seconds. Does that feel relaxed to you? Does that feel uncomfortable? Does one hip hurt more than the other? Do you feel like your feet are straight, or is one foot coming out more than the other two? Are you naturally shifting to one side? All right. Heels, hips, shoulders, and head. All 4 points should be touching the wall. Should feel relaxed. Okay. Again, from here to perfect. From here, how to check your walking posture. So you want to come off the wall, hold that position, and see if that feels normal to you. When walking, meaning we want to walk with the weight on our heels, not on our toes. When we shift on our heels, our body stays more upright, more straight, forces us to stay up. On our toes, we can naturally hunch forward. We can even rotate too a little bit. So staying back on our heels allows us to maintain that better position so we don't rotate or bend forward. I'm going to use your walker in a second to show you something different. Okay? Any questions so far? Boom, boom, boom. Easy, right? So we've gone through standing, sitting, and walking. Which muscles, when you're in poor posture, which muscles are tighter? What do you think? Back muscles are actually weaker.
You think that they're holding you up, just.
They're trying to hold you up. They're weaker. Ugh. Which muscles are tighter right now? Stomach's tight. How about up here? Is that tighter or weaker? Are they in or are they open? So if I'm closed, the muscles now are shorter and weaker. I'm sorry. If I'm here, I'm tighter up front. The muscles now have shortened this way. My back muscles here are going to be stretched out and weak because they're not holding me back anymore. I force them to want to weaken to hold me here instead of holding me here. So we want to, exactly, so we want to do is keep them strong in the back, stretch out in the front, so we're strong here, not rolled forward. When I have poor posture, I naturally hunch my body forward, my shoulders rotate inward, and my chest tightens, and my upper back weakens. Now go to lower body, now my hips will tighten to hold me from falling forward. They hold me back now. Now my lower back weakens, my hamstrings tighten. My quad, because part of my hip flexors, they tighten also to hold me from falling forward. I've changed my center of gravity from normal, but I'm still not going to fall because my body will adapt at that position. Same thing when I'm sitting too. So I'm going to sit like this here. Same thing. I'm going to have tighter hips, weaker quad or tighter quads, tighter hamstrings. Now they're shortened, right? They're not lengthened out anymore. They're shortened, tighter, weaker, tighter, rolled forward, and weaker upper back. Even here, tight upper traps because you're trying to hold your head from falling forward. You can't use your lower body anymore to not fall forward. You use your upper traps and shoulders, so we start doing this even more when we're sitting. So we maintain our posture, our center of gravity here, back on the chair, versus more relaxed. That makes sense? We're not gonna lose balance. We're gonna use different muscles to hold us from losing our balance. Until they get so tight, you want to go see a chiropractor for some reason. I don't know why. Alright, questions yet? All these postures here, these poor postures, is why people see me right now. Not because of trauma, not because of injury. Some accident cases, yeah, some falls, yeah. Most likely it happened over time. Like, well, what kind of work do you do? I sit for a living. Oh, let's check your posture. We tried to get them to sit back here, like, doesn't feel good. I'm like, fantastic. Let's get you back up here. Boom. So we adjust them over time. It takes your brain. What part of your brain controls your balance? Your ear will throw off your balance, yes. So part of your brain is your cerebellum, back of your brain, which is part of your spinal cord, which is part of the nerves that go to your arms, your legs, your overall body. That part of your brain has all signals of where your body comes in from your body and helps coordinate and balance out your body. If you stay here long enough, it's going to balance out your body here. Stay here long enough, it's going to balance out your body here. It's not long enough, it's about 2 to 3 weeks for some people. And if you move more, it'll get your body to reset that balance even faster. Boom. Questions yet? Fun, right? Yes, ma'am.
Okay, my English is
No, you're good, you're good.
What would you be the best posture for women when you use a skirt?
Yep.
One.
So a skirt would be the same thing. Here. A shorter skirt would be tough because you almost want to be here and just here.
And your heels are up.
Your heels are up. Heels up on your toe. So, yeah, and almost you want to be here. You'll still have your legs a little bit lower too if you need to, so you're here. Because the problem is once you cross your legs, that's more back pressure. You're causing, anytime you, again, good question. Once you cause a twist in your body, that causes more torque, more pressure. Some people sit like this when they're working. Like that's nice. But the problem is now you're twisted here, so now you're gonna come back here, causing more pressure on the left-hand side. So you want to have, if possible, the knees even and the feet even to cause no rotation in your body, if possible. And again, leaning back is the key. If you lean back, you're not going to want to rotate. You have a good question though. If you have a skirt on, you want to go a little bit lower just to make sure you're here, more even. Because once you cross your legs, it's almost like that torque causes more back pressure.
When you cross your legs, you could get leg caught too.
You could.
Yeah.
You could. But it's something to where you have to really watch what you're doing overall. And again, this is not sitting for 5 minutes, it's sitting for maybe half hour, an hour, 2 hours. Some people sit some people sit 3-4 hours at a time just to get their work done. They don't even think about how they're sitting, so you go to get up, you're like, oh, what did I do that for? Once you move, then you feel the soreness. Oh. So you can focus on getting your posture set right first, allows you not to have any problems. Again, we'll go over this stuff in detail. All right? Next question. Now figure out what muscles are tight in the poor posture, muscles are weak in the back and shoulders and neck, and also to tighten the hips for 1, 2. How do we stretch our body? Okay? I'm going to go to the floor for this one. 2. Okay? What I want to do with the pillow stretch, I want to make sure my body, if my body's here, right? What's happening to my neck and shoulders? My head's in front of my body. I have a forward head posture position. I want to get my head further back. So what I want to do is at home you can use like a rolled up bath towel at home. You don't have to do something this, not this thick. But at that point you want to get your head further back than your body. So I'll show you what I mean. If I go here, still standing here from the beach too. Still standing. What I want to do is put that roll on the top of my shoulders. The head falls back. That way. All right, you see that? Head's falling back over the roll, over the beach, over the bath towel roll. So my head stays here to stretch out the neck in the front. You get that whole spine to open up, coming backwards. That allows your body over time to stretch that position. So I want to sit upright, not forward.
I wonder if you have arthritis in your neck.
You got to be careful.
Yeah, that one is not good.
You could probably do a lower pillow, a lower height pillow.
Yeah.
And kind of adjust. You want to always look at modifications. If you feel like that hurts you, go to a lower pillow. I tell people if that feels too good, not to roll up bath towel, they just fold it for now. Over time, you get better to then go further back. It's time. Time-wise, I would do this here. 1 minute, arms across your body, and a second minute with your arms above your head.
Does that hurt?
Nope, I feel great. Take a nap this way. But at that point, you want to do arms above your head for the second, arms above your head. The second minute allows now your body to stretch your whole body out, not just your neck. All right? Why a minute? Why is a minute stretch good for your spine? Why do you think? And when I mean we're stretching it, just hold that stretch for the full minute. Why do you think that's important?
Keep it straight.
Keeps you straight. But why a minute versus sometimes people will stretch, go back and forth, move around. That's how they stretch. Why hold the stretch though? Do ligaments connect the bones of the spine, or do muscles connect the bones of the spine? Ligaments. Ligaments need that constant stretch versus muscles require movement to stretch. So my patients, I have them do a full minute stretch of your arms across your body, and the second with your arms above your head. That's
30 seconds?
1 minute.
1 minute.
1 minute for each position. That gives you enough time, but again, if you feel like that's too long, start with 30 seconds. That feels easy, go to 45, then go to a minute. So you have to build up to wherever you feel good.
Stretch.
So when I work with my patients, I work with them individually where they can start, and then from there build on top of that. Just time, just work, all it is. All right. Second one, upper trap stretch. Where is the upper trap muscle? What do you think? Upper trap muscle, upper trapezius.
Your shoulder, back, shoulder blades.
Shoulders here to see it. Shoulders here attaches to your AC joint. Upper back about T3, T4, and up to the base of your neck over here. So that area there, base of the neck, AC joint, upper back, is your upper trap triangle muscle. So where does it pull? It pulls this way when it's contracted. When it's weak, it'll get your body to have that hunched over posture. So you want to make, if that muscle is tight because we've been in that poor posture for so long, we have to make the muscle stretch. Okay? How do we stretch the muscle? We're gonna take, if you want to stretch your left upper trap muscle, you want to bring your right hand behind your left ear. Then from there, now turn your head to that left shoulder you're working with, that left side, and let your head fall down using your arm toward your body. Okay? How does that make sense? Does that make sense? So again, if I'm in neutral position, bring my right hand, stretch my left upper trap over behind my left ear,
Short arms.
and then lengthen your arms out if you can. Get an extension. At that point, turn your head to your left shoulder and head down toward your body. Hold that for 30 seconds. And everything's just once. Give it time to stretch. Again, this is a muscle. It can stretch a little bit less time-wise. Okay? And if you want, try the other side too. Your right upper trap. Now, bring your left hand behind your right ear. Turn your head to your right shoulder. Let the weight of your arm pull your head down toward your body. It feels so good, doesn't it? Feel so good, everyone? Well, good. Get that stretch in there, my friends. This is you getting your body looser and having a better day. Okay? Any questions? Good, man. I feel better. Whew. All right. That thing is, and you can do these stretches anytime in the day. And these are things you can do seated while you're working or doing anything. Feel it tight, boom, do your stretch. Okay. Next one, the shoulder wall stretch. So here, why do you want to use a wall? A wall straight, we want to get our body straighter, correct? If we're going to work out our body, let's work out in better position so it retrains the brain again to reset your posture, position your center of gravity. I'm going to take my arms on the wall. I want to open my hands up. Why is that? Because we naturally, when we have poor posture, rotate it forward. Get your arms open, and then from there, you want to form an arch all the way up. Hold that on the wall for about 5 seconds or so, and go all the way down. Hands open the whole time. Okay? Get the body to relearn how to stay open, better position posture, versus closed. That's the key. When we move into, as we talked about a second ago, we move in better position, then our body resets that posture position faster, your cerebellum, your brain, versus when you're not moving. So up and down about 4 to 5 times. Boom. All right? That's what they say. 4 to 5 times. That's what they say, whoever they are. I don't know who they are. I don't know. All right? Another one. When we're having sitting, standing, if you want to call it, what happens, we get tighter in the hips, right? Tighter hips. So we have to stretch them. Good? I want to make these hips looser. So I'm going to go down to one knee. Let me do this like over here instead. Here. Put one knee, you can put, if you want, you could put like a towel or something, or maybe a mat or something underneath your knee. If it knee hurts your knee, if you have sensitive knees. If you're like me, very sensitive. At that point, I want to form a right angle with my right knee coming up, my left knee on the ground so I'm more upright. If you need to use a chair for balance, you can, or use your body for balance if you need to.
I'm just wondering how many seniors can go all the way down.
That's what I'm saying, there's different ways to do this.
The problem is getting back up again.
That's why you have the chair. That's why you have the chair next to you. Okay? We're going to go from here. We're going to lean forward, and then push up to get that hips to stretch more. Lean forward and push up. Use a chair if you need to push yourself up. All right? So hold it 15, 20 seconds. All right? That feels good. Then switch sides. We go underneath here, here, and then here. Again, I'm going to use my hands on my knee or hold the chair, lean forward, and push up to stretch my hip. And lean back, right? Muscles are hunched forward, opposition, lean back. Get that body to stretch more. Questions? All right, tell it these going to be good for you, just to get that pressure off that knee. Lean forward, push up. And if you need to, use the chair to get up into,
Now that's us.
or help, someone help me. This dang doctor told me to get in the floor and I can't get up now. What do I do? Now, gotta have fun, right? If we're not having fun, what are we doing? Now, here, okay. How do we walk? Number one exercise you can do on your own, simple, is walk. But if I'm walking, and I'm walking like this, is that good posture? Thumbs down, no. Okay? So how do we set our posture to walk? I want to go against the wall. Let's go against the wall here. If there's a wall, if not, we can figure something else out. Plan B. Use a pole or something, or have someone stand up for you. At that point, use the wall for 10 seconds or so, 10, 15 seconds. Take a step forward and put the weight on your heels. Okay, that's the key. If I come off the wall, I want to be in that same wall position. So we want to put the weight on your heels, so we're staying back here when we walk, not on our toes. All right, if you want to improve things, you have to change something. You're going to feel here when you walk uncomfortable and weird because it's going to be different for you. Your body's going, what are you doing to me? You want to feel weird and comfortable until it gets comfortable. I want to cause a change in your body. Your muscles adapt to here instead. When we walk, when we move when we walk, you want to walk heel to toe. Heel and toe. Okay? If I'm helping someone learn how to walk, I'll have them use a wall for balance and practice just rocking their feet heel to toe. Get those to your feet to realize they have nerves too, that proprioception to rebalance where your body wants to have that rhythm when you're walking. Maybe five times this way, one way. Feels good. Switch sides. 5 times this way. Where's my head when I walk?
Straight up.
Straight up. I'm looking down with my eyes, not my nose. I'm not doing this because I'm going to do this. I'm going to go back to here. My head up as much as I can, looking down with my eyes, to make sure I'm not going to run into someone. A midget or something shorter than me, I don't know.
I think I remember sometime, look 10 to 15 feet ahead of you. And that
Exactly.
way,
Yeah.
You're not, but again, it takes time though too. Some people are scared when they walk, I understand that. So go slower. But position, when I have someone walk and I want to help their posture, I'd rather them, I was talking to a younger guy this week about walking slower until his back was better, because his back was pretty sore. Here, until that felt a good position, and then go further, go longer, go faster. So here first, weight on your heels, walk heel to toe as their head's up. If you want to train your posture this way and be a little fancy with it, use the wall for balance, close your eyes, and walk heel to toe. And then always, as you know, always go on both sides with your eyes closed to really test your balance and your posture. All right. Why do people walk this way? Habit. It feels good to them. They may have had an injury too. A lot of people don't realize when they have an injury, unless they've rehabbed enough, they're going to walk where the injury tells them to walk. So you want to make sure over time when they're comfortable, get their body back up slowly. A lot of people deal with that have injury, and then they learn how to walk differently, becomes their normal. And then they start having back pain, hip pain, knee pain, ankle pain. So when I check them, I assess them, I see where they are standing first, then how they walk. Sometimes when people walk, they'll stand fine, also they walk and they do this with their foot. Foot comes out because it feels better to them, because they had a leg or a knee injury. Start walking like this instead of walking with their feet straight. So I want your feet, same thing, I want your feet straight the whole time, because that's less pressure in your back. Mechanics of your hips, your back, your legs, your knees, and your ankles are meant for your feet to be straight. If we walk with our feet out enough, what happens to your knee joint? It's a hinge joint, so it doesn't really have that groove anymore. You're off the groove, you're off alignment. Like a car alignment, if you're off long enough, start rubbing the cartilage inside your knee, causing knee pain. So I'm going to watch where you walk and help adjust that too. Get me? Got it? Cool. Next one. How do we now get our muscles to endure standing, walking, sitting longer? It's magic. I don't know how you do it. How you do it? Do you guys know? I don't know. I know, but we'll figure it out. So we talked about walking this way. That's number one. Okay. Now we talked about wall squats. So wall squats are these. Okay. Fun. Wall squats are fun. I enjoy them. Here, I want to work out again, as I said for the fourth, fifth time, in better position. So I'm going to be pumping up for wall squats. I'm going to put my hips on the wall, my shoulders and head on the wall. With my feet and my knees, I want my feet about probably a foot, your foot size, away from the wall. Okay? But I want your feet straight the whole time. We're going to do now, we're going to move in one plane, coming straight down with our body on the wall, coming down, go only down enough to where your hips stay above your knees. Hold for about 5 seconds and come back up. If that doesn't feel good, or you feel like, uh-oh, what am I going to do? Put your hands on your knees. So if you need to, you can push yourself back up with your hands. Who wants to try this? Who wants to be my volunteer today? Come on over. Ha! How are you doing?
I'm doing well, ever since I went to see you and got my treatment.
I like
I've
the
been doing
testimonial.
great.
Good job, good job.
You did a good job.
Well, a lot of it is you learned, again, you already knew what you're doing, just readjusting what you're doing. So head against the wall. And now feet out a little bit more. Good, because you can handle it, you're fine.
Sure, I'm gonna
And
fall.
now slide down a little bit. More. Hold. Count to 5. 1, 2, 3, 4. 4.5. 4 3/4. 5 coming up. Head back. Head back the whole time. Come on down again. Hold. 1, 2, 3, 4, 5. Come back up. Where do you feel that?
Good.
Where do you feel it? More in the legs, more in the back?
Right here.
Lower back. Lower back. The body coming back like that makes these hips work more. Here, you're gonna feel the legs too. You're gonna feel those legs also. You can feel the whole body come up using your hips more because your back's on the wall. Because your back's on the wall, your back's supported, these muscles work harder to hold your body back where you should be. When you come back up, don't lock your knees, but kind of put them where they feel comfortable. When the last time, I'm like, don't worry, lock your knees, I don't care. At that point, come down, hold again, 5 seconds, and come back up. About 3 to 4 times. Again, as you feel good, build up more reps, build up more sets.
Is this good for your sciatica?
Exactly. When I have someone who's recovering from sciatica, adjusting's good, icing's good, stretching's good, you have to build the muscle. Because their back is supported on the wall, you're not gonna hurt your back on this one. It's a good way to start your exercise with this one. It's a key. Okay? Now, 3 shoulder exercises. Oh, fun ones. Who uses water bottles at home? Everyone, right? Most people do. Okay. What brand do you like to use? I use Sam's Club. Use any brand you want, doesn't matter to me. Okay? Use your brand, take 2 water bottles, these 8-ounce bottles. I think 8 ounces? Is that right?
They're not even 1 pound, are they?
So they're 16.9 fluid ounces, not ounces, fluid ounces. They're about maybe 1.5 pounds. About 1 pound. At that point, the number one, so with these 3 shoulder exercises, how do we get our body to relearn this position? How do we stretch it and strengthen here? Okay? I want to do, what muscles are weak when I'm in this position? When I'm going, hunching forward, standing, what's my weak muscles? Is more my chest or my upper back? What's weak? The upper back. Good job. Someone's paying attention. This is weak here. I want to get this upper back stronger, so I want to do is pull it in. Okay? In and down the same time. So I'm going to have you do, to start that, number one exercise I'm going to have you do, water bottles next to your sides, water bottles pointing up, thumbs pointing up with your water bottles, elbows locked into your sides, let your arms come out from you, keep the elbows in. All the way out, hold for a second, and come all the way in. Again, do it again. Elbows in, tucked in. So some people do this, sort of this. That feels easy. I'm like, I know, because you're not doing it right. Keep your elbows in, all the way out, hold for a second, then come all the way in. Okay? You want to hold for a second. You want to really feel that hold back here. You want to pull those muscles in your upper back, hold, and then come back in. Again, the wall is used to help you train your posture as you move. Boom. Any questions about that? Number 2 of the 3 shoulder exercise, 2 of 3. Same thing, shoulders or elbows down, horizontal or parallel with your shoulders, your elbows, and then point the water bottles in, top water bottles in, thumbs pointing toward yourself, and then bring those arms, those wrists straight up and touch the ball of the wrist. Some people will say when I do this, that feels easy, doc. I'm like, yeah, because you're not doing it right. Elbows stay straight the whole time. Bring your arms, just rotate your hands back to the wall. Hold for a second, then bring your hands down parallel, again without turning your hands or your wrists. Boom. Questions about that? Huh? Easy? Not so much sometimes. We'll see in a second. We'll see if we can pick as a volunteer this time. Now that's 2 of 3. 3 of 3. Third exercise. Instead of being on the wall, now what we're going to do is bring your hips on the wall, feet off the wall, getting that whole foot away from the wall. What you want to do now is tilt your upper body, hinge your upper body away from the wall, and hold that straight position. Okay? And that's straight position with your back. Now bring the water bottles pointing forward, and bring the water bottles out to your side. It's called a reverse fly. Water bottle out to your side, coming up, head up the whole time. And here you want to do now is you want to pinch back here. Okay? If this exercise, bring your hands, your wrists to the wall here, was more maybe lower mid, this one directly up here, make you want to come up and pinch, hold, come back down. So again on the wall, 3 of 3, 3 shoulder exercise, feet off the wall, hips on the wall, hands forward, water bottles come up, they come up right parallel with your head, hold for a second, then come back down. All right. Any questions about that one? Solid? Good? Got it? Who want to try this? Anybody? You're a volunteer. Come on up. Come up. Yeah, I want to see you do it.
You know, tired, I just did Zumba for
I know, you're so tired. I'll let you take one of these water bottles home then, okay?
What do you want me to do?
This one I just showed you.
What?
So this one, and elbows like this.
Okay.
And then do now is put the elbows up. Up here. And here I'm gonna have you do now is bring those hands out this way. Boom. All right. Yep.
Feel it in my shoulders.
Boom. Where are your shoulders? Here or down low?
There. Up,
Very
up,
good.
up.
So we get the shoulders to come in, hinge, hold, and come back in. Can you come all the way back to the wall? Yeah, it's tight. It takes work. See, look. Cheater.
I can't touch that.
Okay, we gotta keep the elbows in. I'd rather keep the elbows in and go back as far as you can. Hold, then come back in.
Okay. Try it.
So if you go back in, it hurts. So hold that position
It did,
and do
but
it
now
over
it's not.
time.
Try it.
Next number 2. 2 of 3. Elbows up here now.
Okay.
Okay, and then what you're gonna do is bring your elbows in this way. We're bringing these wrists to the wall.
To the wall?
Both of them back here.
Ay. Ouch.
Ouch! So again, if you can't go all the way up,
Ay.
that's fine. Start where you're comfortable, then come all the way back.
Wow, that's hard to do.
Yes,
I didn't realize those muscles got weak. I
Boom.
didn't know that.
It's work. It's work.
Ay.
Okay. Number 3. Now, instead of being flat on the wall, with your hips on the wall,
Yeah.
feet forward, and then with the upper body now tilt forward. Good. Not that much. Right there. And then thumbs like this. The water balls. Very good. Yep, like that. That's right there. We do now. What we're going to do now is now bring them up here. Head up. Shit, up. Here we go. And hold, and then come back down. Good. Head up. Hold, pinch, and bring it back down. How's that feel? Good. You can do this 1 of 3. Takes time. It's work though.
You never know.
Never know till you try.
Till you try.
You know, that's the thing. We have to work on it. We have to work on it.
Really feel it.
Yes.
Here.
That's where I want you to feel
Yep.
it. Good job. Good job.
Thank you.
All right. It's not. We had confidence. We had high hopes. We were crossing our fingers. Okay. Last one. How do we now, if our back is like this, right? We have not just a weak upper back, we also have a weak lower back. Hit the lower back stronger also. So besides the walking, also want to do a kickback exercise. Again, you can put the towel down if you want, or on a pad, or whatever's easier for you. Want to come down to all fours. Again, get help if you need to. Then you want to do is bring that leg straight up, bring that foot behind you if you can, then come back down. Okay? So you can do it even in bed if you want, wherever you're comfortable with. What you want to do is keep your body straight, bring that knee, because you're on your knees in your hand, bring that knee up. And if you may want to start here, that's fine. Hold that. When you're doing this, once your knee leaves the floor, you're contracting all of your hip, your glute, and your back muscles on that side. You gotta get strong. For stronger here, what happens? You stand up straighter. You build the endurance muscles to endure sitting and standing. It's everything.
Does that help the sciatica? 'Cause
Yes.
it's almost there.
You're in the same position. Same muscles of sciatica that get weak. You want to make that back, hip, glute, and hamstring stronger. So here, hands on your hands and knees. Bring one leg up where you're comfortable, maybe here, maybe back here. It's up to you. Hold that position for about 5 seconds. You're going to feel the other side, see the other leg that you're not lifting, feel a little contracted. It's trying to hold that position. So you're not going to do this and then lean over this way. No, you're going to fall down and hurt yourself. Keep that body still. Let your muscle contract first and then bring that leg up. So this works on balance, core muscles, along with the overall muscles you're working with movement. Okay, so same thing. This side here, if I'm here, at that point bring my hands and knees, my left leg up, hold where you're comfortable. If you can handle it, come all the way up as much as you can. Hold for 5 seconds, and then drop it. Recommendation, 3 to 5 times on both sides for 5 seconds. There's a combination Pilates thing. I call it a kickback stretch exercise. But it's giving yourself enough room to work with. Well, that doesn't feel good, so I have to do it. Versus that doesn't feel good, I'm not going to do it. Different mindset. Okay? When it says doesn't feel good, it's painful where it contracts and guards and tightens and sore later. Hold off on it. Minimize it. Find a modification. If it's uncomfortable, but it's just tight afterwards, I'd do more of it. I had a guy he walks 2 miles a day, had exercise, like, man, my back hurts. Good, we found muscles you have to work on. We can walk, we can move, we can use different muscles to walk and move. We have problems in our back that we kind of fine tune where those muscles are. This exercise will kind of work out those muscles that aren't working properly. Get them all working properly. All right? Any questions?
I have a question.
Yes, ma'am.
My daughters that get sciatica, they
Have a
think
good
it's
day.
from, I think it's called lifting. Maybe they're lifting more.
Are they stretching enough?
I don't know. She's a caregiver, so she takes care of veterans in their home.
Mm-hmm.
And if they have to lift them, then she gets the sciatica.
How does she lift them?
I don't know.
That's when I have patients that work with as a caregiver or even helping other family members too, I always tell them, if I'm going to lift someone, I'm going to make sure I brace my leg on something, even on their chair.
Good idea.
That's when you brace yourself. This is moving, but you want it's not going to move. Brace yourself at that point, that brace yourself, then you help them up. All the weight's on your leg, not your back.
So you've got support on the chair.
Exactly. So you want your legs supporting against something. At that point, you're lifting with that support already locked in.
Good idea.
You know, that's one thing people don't realize. When they're doing this, they're like, oh, my back.
That's, sure.
They don't teach them that, what to do. No, we don't learn that. There's no book on that. But that support allows you to give that leverage where the stronger leg muscles versus your back muscles takes all the weight.
Are you bending both knees?
I'm trying to keep my legs here,
Both legs?
and then from there just coming straight up.
All right.
But that leg on there
And what
allows me
has the support?
have support on that table.
Okay.
So I can move this leg over, and now I feel like there's less pressure on my back.
Okay.
Yeah, that's the key. Yeah. Any other questions, comments, concerns?
A lot have to do with how you sit too.
So sitting, we want to make sure we're on the first third of the chair, leaning forward. So we're here sitting. So again, first third of the chair, knees below the hips, up on your toes if possible, inside or outside. So our body stays contracted, strong, versus stretched out and weak. You just don't think about it. You know, it's staying up here. At that point, our body can stay active sitting versus relaxed, stretched out, and weak sitting.
When we were kids, my mom would always tell us, don't, you know,
Yeah.
slouch,
Yeah.
or sit straight.
And they're like, I was like, yeah, whatever. She's not looking, I'm gonna sit this way. But that's why, you know? Because sometimes don't think about those muscles we use. By doing these exercises, then you can sit longer this way, but if you go, so it's not gonna hurt you. When we're stronger here, we can do this, it doesn't feel good. Because this is what we're used to. This feels good to us. Once we change our posture, it doesn't feel good for a couple of weeks, then all of a sudden, because I don't like this anymore. Our body gets used to this as your normal over time. It takes time to build the muscles here to make you want to stay here. That's what takes time.
I sit on the couch, and so there's something here that I can't bring my knees and my legs back.
How long is your couch?
About 6 feet.
I would rather lie down on the couch, lie down,
Yeah.
than sit.
Okay.
And
My
like,
dog is there.
huh?
My dog is there.
Don't step on your animals. That's inhumane. That's abuse.
Listen.
That's abuse. But that's abuse. But you want to, if I'm on a
That's
couch,
why I said too long. It's at night, you know, you're watching TV, you've been going all day long.
Yeah.
And I'm sitting there too many hours, and I should sit better, you know.
sit better or lie down instead.
Lie down.
At that point, if you're lying down, there's no body pressure.
You know.
If I'm watching a movie with my wife, I'm lying down.
Yeah, yeah.
On the couch, I'm lying down. I don't use a recliner. I use to lie down. And just prop yourself up.
How about, is there a certain position when you're laying on the couch?
You want to support your head. I like on your back, on the couch, you're on your back. And support your head enough to where you don't feel you're contracting. You're not having to have to sit up to watch TV.
Yeah.
Make sure there's enough support in your head so your neck muscles relax.
Yeah.
Your neck's relaxed. If you think these muscles are SCM muscles, touch them. If I'm here, they're going to be tight. If I'm relaxed, they're going to loosen up.
Oh.
So get them to come back enough. Just do it in your body. You know, but if we're sitting so much, we're like, and the couch normally do, it just doesn't feel good. Get your body back here or lie down.
So I have to lay down and do it laying down.
Or just move your dogs out of the way, animals out of the way. And moved. All right. I know, it's our mine too. Mine will sit next to me and like can sit next to me the whole time. Yeah. Any other questions? Next talk next month is neck pain recovery, the problem and how to fix it.